With 149 physicians, 79 mid-level care providers, 902 staff members in 18 locations in Albuquerque and Rio Rancho, the ABQ Health Partners is a physician-led multi-specialty medical group leading efforts to bring total care and patient-centered care to the community. Joining us now is Dr. Lance Wilson, who is the medical director of ABQ Health Partners. Doctor, thank you for joining us this morning.
Thanks for having us.
Yeah, absolutely. So big day coming up for people that want to enroll in Medicare. Open enrollment starts on Wednesday. Is that right, the 15th of October?
That's correct. Every year at the end of the year in the fall, between October 15th and December 7th, Medicare patients can change plans if they want to, but that's the only time of year that they can do so.
Okay.
And this year it's especially important because there's a couple of things that are going on that might be a little bit confusing for folks. One is there's also an open enrollment going on for expansion of the Affordable Care Act.
Okay.
And so seniors that are signing up for Medicare plans don't need to worry at all about any of the health exchange kind of options. They really just need to focus on the Medicare plans. The other thing that might be a little bit confusing for folks is the fact that the Loveless Medicare product was purchased last year by Blue Cross Blue Shield.
Right. Right, yeah, and I know some people, I know especially a lot of folks in my family, they sort of dealt with that changeover, but I think it was handled very well, and every time they had a question about how it worked, it was handled very well by your staff. So from my family, thank you very much for that.
Thank you.
Now, speaking of the care that you receive there, we hear the phrase total care a lot with ABQ Health Partners. Let's talk a little bit about what that means.
Yeah, so what we consider total care is to be sort of a VIP kind of treatment for patients at no additional cost. And really what you do in a total care model is you focus the whole care team on the patient.
Okay.
And that means everybody, all those 900 employees that you're talking about, every single person contributes to that care. The physicians, the nurses, the staff in the office, and we focus everybody on the patient to deliver the best care that we can. And the way we do that is mainly through communication and coordination. So communication, all of the providers in our group, all of the mid-level providers, all of the specialists, everybody is able to communicate through our electronic medical record, and so we can share what's going on with the patient, we can share what testing they've had, what they need, and that communication leads to better coordination of their care.
Gotcha.
That coordination is much more important for patients that have chronic conditions, people that need a lot of additional care, people that have frequent doctor visits and things like that. So with our electronic health record and our communication, we feel like we're able to deliver more comprehensive care for patients and help with their quality of life.
Okay. Now, as we're talking about Medicare and things coming up, I'm sure a lot of seniors out there, like you said, they may have a lot of questions going into this. They want to make sure that they do the right decisions. You guys are on staff to help them navigate through all of these decisions. Is that right? They can call you guys up, talk about their conditions.
They can certainly ask some questions. There's also going to be a lot of events going on in the community with insurance brokers and things like that. So a lot of that information about where we're going to be, things that we're hosting or things that we're participating in, those are going to be on our website at ABQ, or www.abqhp.com. And we also have a Facebook page, and we're on Twitter and Pinterest and all that stuff. So if patients want to get information there, they can find out where we're going to be and where those events are going to be so that they can come ask questions if they need to get additional information.
That's great. That's great that you guys are so spread out across social media. Again, that kind of fits in with that total care. Regardless of what you're doing, if you're used to the old school way of talking to your doctor, or you're used to social media, it's easier to do that. You guys make it very simple for all of your patients.
Yeah, and the other thing is patients have access now to their providers through our patient portal, which is the access to some of their medical records and also a way to message their provider, ask questions, request appointments, and things like that.
Great. Doctor, thank you so much for all the service you have and all the service that you do. And for more information on the ABQ Health Partners, and if you have any questions on the Medicare open enrollment, head over to CAS.com and click on the Style tab. But for now, we're going to head over to Brittany.